Good afternoon, everyone, and good evening if you're joining us from parts of Canada east of British Columbia. Welcome to this UVic Alumni and Friends event. My name is Lisa Kalynchuk, and I'm the Vice President Research at the University of Victoria. It's my pleasure to be the host for our event today. Before we begin, I want to acknowledge with respect the Lekwungen peoples on whose traditional territory the university stands, and the Songhees, Esquimalt, and Wasanich peoples whose historical relationships with the land continue to this day. At the University of Victoria, we're proud to be one of Canada's leading research-intensive universities. With research strengths in areas of healthy aging, mental health and substance use, and a commitment to community and Indigenous wellness, our researchers are improving the social, cultural, and economic well-being of people in Canada and around the world. Experts from across campus are mobilizing research and community partnerships to meet the challenges of the COVID-19 pandemic. And through today's event, we are pleased to showcase 3 of our current research projects that aim to reduce the negative impacts of COVID-19 and contribute to social and economic recovery efforts. On behalf of the university, I want to thank the Alumni Association for organizing this event on accelerating community resilience in the age of COVID-19. Before I formally introduce our presenters, I have a few housekeeping notes I'd like to share with you. To help ensure streaming quality, your audio has been muted and videos turned off, as we have set this event up so only the presenters and myself will be on the video. We will be using the Zoom question and answer feature for questions after the presentations. Depending on the number of questions, we may or may not be able to address each of your questions. Today's event is being recorded and will be posted on the alumni website. And now to the presentations. I am pleased to introduce Dr. Rishi Gupta. Rishi is an associate professor in the Department of Civil Engineering and a fellow of Engineers Canada. Rishi's research is based out of the Facility for Innovative Materials and Infrastructure Monitoring, which he leads at the University of Victoria's Faculty of Engineering. Rishi and his team are working on using nanotechnology to create smart concrete that heals and seals cracks, greatly reducing potential infrastructure disasters and extending the lifespan of buildings and structures. In light of COVID-19, Rishi has pivoted his research focus to developing a novel, acrylic-based coating that can be applied to different types of surfaces to repel the coronavirus, including wash basins for deployment in public places. Rishi, over to you for your presentation.
Thank you very much, Lisa, for the kind introduction and the background to my research. I also would like to join Lisa and my fellow presenters in welcoming all the alumni and non-alumni of the university. I hope in whichever part of Canada you are, I hope you guys are keeping safe and your families are safe as well. I have roughly about 10 minutes for this presentation, so I'll try and keep this quick. There are 2 aspects of the presentation that I'm hoping I can convey to all of you. The first one is a little bit of shedding of light on the research that we're doing on the novel coating, which hopefully would be able to stop the spread of the novel coronavirus on different surfaces. And the second one, a little bit of a softer goal of our research is to promote hand washing. And not just hand washing, but the idea would actually be to promote safe hand washing to keep all Canadians safe. Next, please. So I thought I would begin my presentation by telling you a short story, and just thought what has happened to date and what actually transpired me to get into this area of research, which is actually a little bit typically far away from a civil engineer doing research. So we know even pre-pandemic that hand washing is one of the top ways to curtail the spread of different diseases, including COVID and things like influenza. I put some photos, and these are very recent photographs. The one on the left of the screen is a photo I took last month when I had my toddler with me in one of the parks in Saanich. And one of the signs said, play it safe, wash hands. But the parks that I go to or take my toddler to the parks do not have a facility to wash hands. The second photograph in the center of the screen is from the chief doctor in British Columbia, Dr. Bonnie Henry, and she's been suggesting, this was a tweet that came out about a month ago saying wash hands. And the photo on the right-hand side of the screen is just 4 days old from my toddler again, who's in kindergarten, and came back with this wonderful drawing saying, when should we wash our hands? So we know hand washing is very important. Next slide, please. But I wanted to mention that I and my family for the longest time have been very paranoid about hand washing. We always have been very diligent in washing hands, but there are a few concerns that we always noticed. So again, there's my toddler trying to wash her hands in a public washroom just last month. And she is slightly taller than her average peers, but you can actually see that she's trying to reach the faucet. But in the meantime, she's actually getting in contact with a lot of high-touch surfaces. So this was always very concerning to us, and we always wondered if washing hands was actually doing good, or we were actually ending up picking up more pathogens by the time we had finished our hand washing. The second photograph, I don't expect any of you to be able to read what's on it, but that's actually a layout of one of the malls, again in Victoria. It's actually the Mayfair Mall. And the black arrows, the three arrows, are all meeting at a point where we love to park our car in the parking lot that's just off Douglas Street. But you will notice that that location is very far away from the two washrooms. A third one was just recently added. But the idea here, or the issue being that even if you washed hands in the washrooms, by the time you walk back to your car or wherever you were, your location for commuting was, you probably end up getting in contact with a lot of high contact pathogenic surfaces on your way out. Next one, please. So continuing the story, in April of this year, my phone rang, and one of my industry partners, like me, was thinking about promoting hand washing. And they said, should we collaborate and think about contributing to the better good of the country? So in April or May, coincidentally, there was actually a call from NSERC, which is the Natural Sciences and Engineering Research Council of Canada. And they were actually had a special call for projects that were dealing with COVID-19. So very quickly, in a couple of weeks, I and my industry collaborator put together a proposal, and we were actually very fortunate that in May of 2020, we actually got a project approved for 1 year with some funding. Jumping into the research side, there are a few goals of our research. The first one is coming up with different surfaces, which are self-cleaning, which hopefully have some antiviral properties in them. Our project goal is not just for new wash basins, for example, but the project is aiming to be a little bit more broad, and we can hopefully have a coating that can be applied, for example, to your existing kitchen countertops. It could be wash basin countertops, it could be floors, for example, or even walls for that matter. One of the soft goals that we have in this project is to deploy portable wash basins using the coating, and I'll touch upon this a little bit more in my next slide. So we have a few expected outcomes. I want to acknowledge my industry partner on this project. It's a 100% Canadian company called Valley Acrylic. It's based out of Mission in BC, and we are hoping by the time we finish this project, there actually would be a new product line with wash basins which have a COVID-resistant coating. The second point here is I'm hoping by the time we finish this project, we will end up promoting hand washing. But the key here is the text which I have underlined is a promotion of hand washing, like I showed you on my second slide, has been happening for many years. And I think we've actually done a great job at promoting hand washing. However, the infrastructure required, the location of the wash basins need to be decoupled from integration within washrooms, for example. So wash basins do not always have to be in wash basins. We need to change that philosophy and try and have some wash basins at some strategic entry and exit locations of public places. The last point here is, like I mentioned before, we are hoping that the coating could also be applied to different existing surfaces. You see a small photo there, just looking from downtown Victoria over at the harbor. There's many meters of handrails, and on a usual cruise season, there's actually hundreds and thousands of people that actually frequent this area. So the idea would actually be to be able to coat some of these existing railings and door handles. I get into a little bit respecting that we have alumni and listeners from different facets and different disciplines and backgrounds. So I get into a little bit of detail, but try and keep too much of technicality out of the presentation. We are looking at two effects in our project. The first one is the physical effect. And the short story behind this physical effect is based on biomimicry. We looked at what happens with a lotus leaf, and you can actually see a very small photo of a lotus leaf with some water droplets. And what happens in nature is a lotus leaf may have a little bit of dirt on it, but if it rains, the water droplets actually can pick up all the dirt and end up cleaning the leaf. So the lotus leaves are usually in very pristine conditions on their own. The science behind this is the hydrophobicity, which means that the surface does not like being in contact with water. So that's what we're hoping to have on the physical side. And on the chemical side, there are different materials which are well documented. There's actually a lot of evidence that certain materials do not allow for the novel coronavirus, for example, to stay on them for very long. And one such example is copper. And there's my little copper mug that I've been diligently using for a few weeks, a few months now, actually. And copper is actually known to kill many viruses, including the novel coronavirus. And we are hoping that small additives, possibly at the micro level, these also could be nanofillers that get added in the coating. Next slide, please. Yeah. So this is sort of the main meat of our research work. Again, I will try and not go into too much of details here, but there are different aspects. There's a lot of state-of-the equipment that we have at UVic that we are trying to deploy for this project. The first photograph on the top left is called a tensiometer, and the idea here is to measure contact angles and come up with materials that actually have a very large contact angle, which actually would mean that it's actually a hydrophobic material. We have some state-of-the-art facilities at the university, scanning electron microscopes, looking at the micro, sometimes nanostructure of the material. This project is very multidisciplinary. Keeps me going every day. I learn lots of things every day. And the third part here is the biology side or the virology side of things. And that's where we are actually looking at different materials, exposing them to different pathogens and viruses to see how long they can actually retain the viruses, including the novel coronavirus on them. Next one, please. So with this, I just want to acknowledge a few team, quite a multidisciplinary team from a colleague, Asit in biology, Mohit in materials background. We even have Aditi, our engineering and science librarian, involved in the project. And like I mentioned, our industry partner is Valley. So many thanks to them for helping us and collaborating with us on this project. Next one, please. And like Lisa mentioned early on, my group is called FIMIM for short. And we typically have students, very bright students at UVic coming from different backgrounds. And I know the alumni would know that we get lots of bright students at UVic. And finally, I would like to thank Lisa for emceeing this event and hosting this event. And all of you alumni and listeners, I hope you all keep safe and practice safe hand washing when you can actually find a wash basin. And all the students involved in the project, including Max, Kara, Zerida, and Amin. And I thank you all for listening to my presentation.
Thanks very much, Rishi. That's really great work and very exciting, and a practical approach, I think, to how we can combat our exposure, to this virus. I'm excited now to move on to our next presentation. Dr. Karen Kobayashi will be our presenter. Karen is the Associate Dean, Research and Graduate Studies in the Faculty of Social Sciences. She's also a professor of sociology and a research fellow at the Institute on Aging and Lifelong Health here at our university. Karen is a social gerontologist by training who has published widely in the areas of family and intergenerational relationships, ethnicity and immigration, social isolation, and health and social care. Karen is also currently the chair of the ethnicity theme team for the National Initiative for the Care of the Elderly, and is the scientific advisor for knowledge mobilization and commercialization for the group on aging gracefully across environments using technology to support wellness, engagement, and long life. Karen's current COVID-related research focus is on using technology in new ways to support the mental health of seniors and their care networks. Over to you, Karen, for your presentation.
Thank you so much for the kind introduction, Lisa, and thank you for the opportunity to speak to the alumni today. So many of you are coming from different parts of the country. I appreciate the time that you're taking out of your busy schedules to join us this evening. I'd like to begin the presentation with a territorial acknowledgement. We acknowledge with respect the Lekwungen peoples on whose traditional territory the university stands, and the Songhees, Esquimalt, and Wasanich peoples whose historical relationships with the land continue to this day. Next slide, please. COVID-19 has the potential to have a significant impact on the mental health of older adults in Canada. The physical distancing measures that public health officials have put into place have caused significant changes to the way that formal and informal care relationships are being enacted in the lives of older adults. These transformations in the nature of care, from in-person to virtual or telephone interactions, have had negative social in the form of social isolation and psychological in the forms of depression, loneliness, anxiety, and distress, negative effects on older adults' health and well-being across a number of different care environments. This has certainly been true for older adult populations in long-term care, the focus of much of the recent COVID-19 related research on older adults. However, it's also been the case for community dwelling older adults. This population is of primary importance as governments continue to advocate for aging in place initiatives, especially for care to be delivered at home for as long as possible. Next slide, please. We are a transdisciplinary, intersectoral team of health researchers and knowledge users with extensive histories of collaborating successfully on innovative research projects in health and aging, and more recently, in projects related to aging and assistive technology. Next slide, please. As part of a Michael Smith Foundation for Health Research Implementation Science team grant, our team is investigating how to improve the scale-up, spread, and sustainability of effective and equitably implemented assistive technologies developed by CanAssist, our principal knowledge user partner, to improve the mental health and well-being of community dwelling older adults and their caregivers. Several of these technologies are based on improving communication between older adults and their caregivers in order to enhance connections with family and friends, nurture care networks, and reduce social isolation. In our study, we are exploring issues related to implementation failure based on the lack of participation by older adults, their caregivers, healthcare practitioners, and decision makers. COVID-19 has initiated a burning platform for accelerating the implementation of online communication technologies to help reduce social isolation and sustain care networks for community dwelling older adults. Our government and non-governmental partners expressed interest in using CanConnect, which is a platform developed by CanAssist to facilitate easy access for community dwelling older adults to communicate with informal and formal carers and thus reduce social isolation and the related impact on older adults' mental health. CanConnect is an implementation-ready, novel, live video tablet-based software application that is ideally suited to support the continuity of social connectedness through informal and formal care networks. Next slide, please. CanConnect has been fully developed and it has undergone user testing by CanAssist. Advance, please. As a result of this iterative participatory process, CanConnect addresses well the issue found in a number of studies that many older adults have low digital literacy, particularly in relation to online video conferencing platforms. Low self-efficacy, low digital literacy, privacy concerns, and cognitive challenges in relation to the use of computers and their embedded software can lead older adults to fail to adopt and sustain the use of existing video conferencing applications. And one way of addressing this problem is with the use of a secure, easy to navigate locked tablet. This user-driven design allows for the broader inclusion of community dwelling older adults in virtual communications. In addition, to address the key issue of equitable access to assistive technology in our project, CanConnect will be provided free of charge to all participants, and the tablet will be theirs to keep after the study has been completed. Next slide, please. Our overarching research question is, how can assistive technologies be effectively and equitably implemented to address the social isolation, mental health concerns, and disruption of care networks experienced by community-dwelling older adults that have been caused by the physical distancing measures related to COVID-19? Accordingly, the project has three key objectives. The first is to assess the potential for CanConnect to mitigate the negative impact on mental health and well-being of physical distancing measures on older adults and their care networks. The second is to apply participatory research methodologies to ensure that older adults and their care providers are meaningfully included in the implementation of assistive technologies that aim to support care system redesign in the wake of COVID-19. And third, we want to explore community-dwelling older adults' experiences of social isolation, mental health issues, and the disruption of their care networks caused by the COVID-19 response. Next slide, please. With current funding from the BC Ministry of Health and AgeWell, we have started work on a one-year, two-phase project to answer the research question specific to the deployment of CanConnect. This is a collaborative action research study with an embedded, iterative participatory design process. The current project consists of two phases with a third phase funded by external sources. Specifically, we're going to be applying for a Canadian Institutes of Health Research project grant to support the completion of phase 3. Next slide, please. Of critical importance to the success of the collaborative project that we're embarking on is regular and sustained input throughout the research process from our stakeholder partners. We will accomplish this through the development of what are called action research teams. At the center or core of the team are community-dwelling older adults. Other key participants are families, friends, and informal caregivers, healthcare professionals, practitioners, and formal caregivers, technology developers and vendors, and health system policymakers. Next slide, please. This collaborative action research study is based on Vancouver Island. In phase 1, we will recruit 25 community-dwelling older adult caregiver dyads who have a disproportionate risk of social isolation due to the disruption of care networks because of physical distancing measures put in place as a result of COVID-19. Sex and gender, ethnicity, class, immigrant status, and place of residence, in other words, rural or remote dwelling older adults, will all be taken into consideration in the recruitment. We will conduct semi-structured individual and/or group interviews online with older adults and their care providers to map their care networks, understand the impacts on mental health and well-being of COVID-19, and identify care needs relevant to the potential assistive technology solution, CanConnect. In phase 2, based on the identified care needs of the older adults and their care providers, the team will facilitate the implementation of CanConnect using an iterative participatory design process. The methods for collecting and analyzing data will be developed and approved by the participants as co-investigators, along with other NGO, healthcare, tech developer, and policymaker partners in our research teams, our action research teams. To ensure equitable access, as I mentioned before, participants are going to be provided free of charge with the secure iPad, custom case, and the software application. We will conduct individual interviews and group interviews with community-dwelling older adults and their care providers via video conference to, first of all, assess outcomes specifically related to mental health, social isolation, connectedness, and continuity of care. And secondly, to identify improvements that can be made to CanConnect to better respond to the needs of community-dwelling older adults and their care providers, healthcare professionals, and the health system. We are going to be engaging with health system decision makers in BC as part of an advisory committee to assess the potential for equitable scale-up and spread of CanConnect to address the impacts of physical distancing measures on the experience of social isolation and the mental health and well-being of community-dwelling older adults and their care providers. Next slide, please. In ending, I'd like to acknowledge the support of our funders and stakeholder partners, the British Columbia Ministry of Health, the Michael Smith Foundation for Health Research, CanAssist, the Institute on Aging and Lifelong Health, the United Way of the Lower Mainland, the BC Support Unit, Family Caregivers of British Columbia, and BC Care Providers. I would also like to thank the UVic Alumni Association and the Office of the Vice President Research for the opportunity to present our research to you this evening. It's been a pleasure and a privilege. Thank you.
Thanks very much, Karen. What a great collaboration that is. I'm really looking forward to seeing this project unfold over the next year or so. And now on to our final presentation. Dr. Onowa McIvor is of Swampy Cree and Scottish Canadian heritage and is an associate professor of Indigenous education in the Department of Indigenous Education at UVic. She teaches, supervises graduate students, and contributes in both the undergraduate and graduate programs in Indigenous language revitalization. She also co-leads the Natalnal Research Partnership Grant, a 6-year project funded by the Social Sciences and Humanities Research Council, aimed at understanding and enhancing Indigenous adults' contributions to reviving Indigenous languages in Canada. Onowa's research spans the field of Indigenous language revitalization, immersion and bilingual education, sociocultural language learning, additional language acquisition, Indigenous education, and Indigenous health and well-being. Her current research focus is on exploring the impacts on, challenges of, and innovative responses from the Indigenous language learning communities during COVID-19. Let's turn our attention to Onowa as she delivers her presentation.
Tante Kidawau, Kananaskamun, Lisa, thank you so much for that wonderful introduction, and thank you to all of the organizers for the opportunity to speak with you today. I want to also begin by acknowledging the territory. You can flip to the next slide. As an uninvited guest to this territory, I want to acknowledge this land that the university sits on and where my home is, where I am raising my children and do my work, is the unceded territory of the Lekwungen and Sanchothan speaking people. And as the way of my tradition, I also want to begin by acknowledging my family. My Nihiloc family is from northern Manitoba. My McIvor family, my late mother's family, and also my father's family is proudly Scottish Canadian from southern Saskatchewan. And I think my dad might be one of your participants on the call. So I have to do a shout out and say thanks to parents for supporting our work all the way along right to this stage. Next slide, please. I also need to acknowledge my research team. The work that we do is highly relational, and although I'm here representing it today, this is a work of many people. So Dr. Carrie Chu is a postdoctoral fellow with me, a member of the Chickasaw Nation, and a new faculty member at the University of Oklahoma. Katheroni Stacy is our community partner from the Ganawage community. Aliki Marinakis and Barbara Yenny are both here at the University of Victoria in the Department of Indigenous Education. And Mel Matthew is also a community member and our research assistant from Chipatom School, who is also a research partner on our new Talmud grant that Lisa introduced, which is a larger grant that this small project is off the side of. Next slide, please. So I'll start similarly to Rishi, telling you a bit about the story of how did this all begin and why are we doing this research? So maybe like some of my colleagues on the call, and maybe some of you who are listening to this presentation today, I think most of us had other plans for 2020, and that includes those of us who do research and teach and so on. But when the pandemic hit, largely in Canada, that was around the middle of March, all of our lives changed immeasurably. And so those of us who do research, and in this case, it's particularly Indigenous language, revitalization, focused work, that really changed a lot of things for communities quite quickly. So the kind of work that we do is relational. It's often territorially based. And that all needed to halt immediately, like many other industries, for the safety of speakers and learners and communities at large. So the Faculty of Education, where I'm located, had a COVID emergency research fund, which we applied for. So the study that I'm sharing with you today is an outcome of that, which was focused on the short-term impacts. And then we've now applied this month, just this month, through SSHRC to a larger grant, Partnership Engage grant, with Ganawage Education Center to continue the research and follow a little longer the impacts, ongoing impacts, and possibly maybe some silver linings or potential even positive outcomes that could come from this time where our field has had to rethink and change the way that we do things. We have some early publications coming out that we've written in the form of situation reports, which are written to be highly accessible. So I look forward to sharing those with you as well. Next slide, please. So I'll start by telling you about the goals that we had and the methods that we use. So we really wanted to then gather and understand what are community responses for Indigenous language revitalization due to the pandemic, due to COVID-19, and then categorize those responses and story those experiences and include our own stories. So the team that I introduced to you, we are all language practitioners of some form, and we all have our own place in the language work as well. And so we are including our own stories and part of the storying that we're doing. And then at the end of that, similarly to Karen's research, there's an action research component to what we do, where we hope to be able to generate and share some resources that will help our field to move forward. So the methods that we used was largely a scan of social media. That was the primary method that we used in order to get a sense of what communities were doing in regards to Indigenous language revitalization work and how they were responding to that. We also did a targeted survey through social media and also via email and had a fairly good response to that. And now we're doing some select interviews, and that's ongoing right now. Next slide, please. So some early findings to share with you. So COVID is not gone away, as you've probably noticed. So this is ongoing. This is new research for us. This is different than what we thought we were going to be doing, as I said. So these are some of the findings from the survey. We had 140 responses, representing about 20%, about maybe 25% of Indigenous languages in Canada. And one of the findings that we've pulled, early findings, is asking communities what the impact has been for them of COVID-19. And sometimes when you do research, it's to confirm something that you think might be going on, but it's good to do research in order to confirm that that is true or not true. So 60% of the respondents to the surveys confirmed that they have shifted to creating and sharing online resources or shifted to online formats for their programming, from in-person to online formats. And about 30% though have stopped delivering altogether the programs that they were doing either in person or online, which is a fairly major impact for the work of language revitalization in Canada. And about 9% reported no change at all, which we think means that they were already doing activities that were likely online. Next slide, please. The social media part of the research that we did was the most extensive. We found we were able to take the posts that we found across various platforms and categorize them into 6 categories. And so this slide shows you those 6 categories, and I won't go into detail about all of them, but just to give you a sense of what that's about. So ways that people were promoting the language, where they might be doing short videos or little puppet shows, that kinds of thing, but also using the language to talk about COVID. So we also saw an increased activity, or new activity really, where people were using their languages to make videos about COVID and educate people about COVID. We also saw training to support Indigenous language revitalization work during this time. So new kinds of online training. How do you move your language revitalization work online? Increased language education, or the shift to online classes. The sharing and creating of resources, again, that all had to be done online. So no more paper-based things or handing out kits of any kind as we used to do. And then the final category was information about language revitalization and about COVID-19, but not in the language, but related to language revitalization, but being shared in English. Next slide, please. So again, some early outcomes. So our first goal was to document the shifts that were happening, but also the innovations, so that we could see if there's any lasting impacts that might be useful to our field. And secondly, to take those innovations, those adaptations, those solutions, and then be able to share them more broadly. So some folks are creating posters and short videos and practical language learning activities. And so we've started a website through the UVic Online Academic Community, which is a free resource to be able to categorize those resources and organize them in a way that they become freely available to communities, so that they can see examples that they might be able to adapt to their language environment. And on the right side of the slide are some of the outcomes that we expect might be longer lasting from this research and from the pandemic in general, which is that the shift to online, we've actually seen greater access for language learning. So people living outside of their territory, but we don't know a lot yet about quality of learning online, or so the impact of that shift to online is yet to be assessed. And finally, what we've heard in the early part of our interviews and the survey research is that we're seeing that people turning to Indigenous languages as a source of comfort and wisdom in times of crisis. And this is something that Indigenous people have always done, but what we see is an increase during this time. Next slide, please. So thank you so much for your interest in Indigenous language revitalization and in this early research that we're doing in this very unusual time. And we hope to all get through this together safely, and for Indigenous languages to remain and continue into the future despite the pandemic. And there may be even some wonderful innovations that Indigenous communities are able to share with one another and strengthen our field even further. Niawan, Miigwech, Masicho, Kananaska Nawao, Haiska Siem.
Thank you, Onowa. That was a very heartfelt presentation and really great work. And thanks to all 3 of our presenters. You know, like many universities, COVID-19, it had a really dramatic impact on our research enterprise and obviously on our communities. You know, as the, I guess, overseer of the research enterprise at our university, I can't tell you how proud I am of our 3 presenters here today, but our whole community, our faculty, our trainees, staff, other researchers who have really taken up the challenge and launched so many different projects that are going to have an impact on society and contribute to recovery. I think at last count, we've got more than 90 new projects that were started by our faculty just, since March. And, you need to understand that most of our faculty already had their research programs underway. They had projects, they had students working on all sorts of different ideas that were part of their funded research programs. But in the face of the pandemic, they quickly pivoted to move to research that they felt was more pressing to try to address societal recovery. And so UVic is doing its part. I'm really excited about the 3 projects we heard about today, but proud of all of our researchers across the entire campus for the work that they're doing. We have some time for questions for our presenters. I would now invite you, if you have a question, to please type it in the chat box. Please indicate which of our presenters you're addressing your question to, and I will try to ask them and invite one of our presenters to respond. So we have one comment, a big thanks for insights to such innovative, pertinent research. So thank you, all 3 of our presenters. I will just wait to see if any other questions come forward, and maybe while our audience is thinking about your presentations and thinking about questions they might want to ask you, I might take this opportunity to just start the ball rolling myself. And maybe I'll start with you, Karen. And I'll ask you this question because it's one that's relevant to my own research. But I think a question that is on the minds of many of us as we look around the world at inequalities and gender issues and anti-racism. And I just wonder, in your work, if you've thought about social isolation and gender differences, and whether there might be any differences in the way that the different genders or people from different equity-seeking groups might be experiencing social isolation, how their social and mental health needs might be a little bit different, and how your research can help to go in that direction if that's an area of interest.
Mm-hmm. Thank you for that great question, Lisa. Yes, actually, we know that certainly if we're going to look at markers of inequality, and you mentioned gender, and I'm going to speak to that in a moment, but certainly class issues intersecting with race and immigrant status have created significant inequities and inequalities in terms of access to communications technology, from speaking about the relevance to the project that we're doing. So one of the reasons why I spoke earlier about equitable access as being so important is because communications technology, or assistive technology in general, has been very expensive to access. And we know that working with the BC Ministry of Health, with their Health Technology Assessment Committee, and with Heather Davidson, who is the ADM for Partnerships and Innovation, that we're actually working together with them to think about procurement plans for these kinds of technologies, so that to make them more accessible to those who can't afford to buy them or to access them. In terms of men and women, in a study that Denise Kluche and I did back around 2009, 2010, when we looked in BC, we're thinking about social isolation, we found that certainly the profile of social isolation, interestingly, it was skewed, we saw, towards men. And we saw, but this was using indicators like how many friends do you have? How often do you seek interaction with them? When we actually dug a little bit deeper and we did qualitative interviews with older men, many of whom were living in sort of rural or remote areas, they were saying, we prefer that. And in fact, that was true of the women who also, who were living in rural and remote areas, who also would be, I guess, deemed socially isolated according to this index, that's being a global index that's usually used. But certainly we see that women are less likely, obviously, to report feeling isolated or lonely because they have larger support networks. And they tend to have more what we would call, I think, deep connections or stronger connections. They retain those connections over the life course, much more so than men. So yes, definitely gender issues and class issues intersecting with race and immigration status and place of residence.
Great, thanks very much, Karen. I'm just looking at some of the questions now that have come forward. And I'm not quite sure, the first question that is in my box here, I'm not sure from Jennifer who that's addressed to. So Jennifer, maybe you could clarify that. And I'll skip to the next one then. This is a question for Onowa. And the question is, could she speak to any particularly creative or resourceful new approaches / initiatives to teaching Indigenous languages she has encountered during COVID-19? So maybe you could reflect on your online teaching and how things may have changed for you.
Yeah, thanks for the question. Absolutely, this is the #1 thing I think on all of our minds, because I think as we all, across industries and disciplines, as we deepen into the pandemic, I think we're all recognizing this isn't going away anytime soon. And we're all having to acknowledge and realize these changes, and adaptations we have to make are maybe going to be around longer than we hoped. So regarding language revitalization or language learning, this person's asking specifically about teaching. I'll share 2 examples that I think have been really successful, but I want to give the precursor that my observation has been across Canada, because we have this wide network and a really strong national network here in Canada, is that those who already had strong programs have found a way to change what they're doing and continue with some new form of strength. I think the more vulnerable situations are those who were struggling before, and I think it's a harder time to try to do something like the kinds of things that we're being called to do under COVID, if that makes sense. So one example I'll share is there's a group in Saskatchewan, the Nihiloc Language Experience is the name of the group, and they've been doing on the land language camps every summer for many, many years, more than a decade. And that whole experience is about being out on the land and learning the language close to the land and making fire and making teepees and being in the water, etc. So you could imagine that an activity like that, you might just say, well, for this year, we can't do it. So what that group, they met and they talked about it, and what they decided to do was to try to do something online. And they did. And so what they did was 4 days for 4 hours a day with 4 instructors. And they met for so there was 4 separate breakout rooms. They had 60 participants, and they separated them into 4 rooms, and they did it on rotation. And so there was 1 hour of intensive language learning with instructor 1, 1 hour off, 1 hour with instructor 2, 1 hour off, etc., and rotated through the 4 days. And by the end, we had a full group closing circle on the end of the 4th day, and everybody was just, the tears were flowing. There was elders there who had been isolated in their home for a number of months, saying how much it meant to them to hear the language and be connected to other people that we're trying to learn, etc. The other example I would share is here on Vancouver Island. There's a group in the Newfoundland territories who are doing just amazing language work, and they were gathering face-to-face before. Chutska is a person who heads that up, and they've shifted online, and they've got double digits of people. I think how they're having good success is that people are coming together in their bubbles, the language speakers and learners, and then they're being able to broadcast some language learning activities so they can do some innovative things in living rooms where people can actually have an interaction that's a bit more authentic for the learners who are on the other side. So I hope that that offers a couple of examples for the person who's interested.
Yeah, that's great. Thanks, Onowa. Rishi, I'm going to go over to you with the next one because, you know, this is actually something I've wondered myself, especially now that I'm starting to go back to work in my office and there's hand sanitizers all over. And so one of our audience members is asking whether you recommend hand washing over hand sanitizer. And so I'd ask you that, but I might ask you even if you could to elaborate on sort of what each one accomplishes. And you know, when we should look to hand sanitizer versus hand washing.
So thank you. That's an excellent question, and something that me and my family keep chatting about every single day. But I'm going to give sort of non-medical advice here because, as you know, I'm an engineer, so I'm not fully qualified to answer this. But I know from the research that we have done that there are certain viruses that actually get eliminated better when we use sanitizers. However, there's a large number and types of pathogens that are actually better removed by hand washing. Having said that, I just wanted to, I would like to mention that there are certain situations where sanitizers can't be used. And what we are finding actually is more use of sanitizers is actually causing dermatitis for many people. So, you know, if you have chapped hands, for example, you know, we used to call it a paper cut test, you know, when you're using hand sanitizers. So if you have chapped skin or dermatitis, it's actually, many people can't use it. And also apparently for small children, it's actually hand sanitizers are not the best approach. So I know I haven't quite exactly answered the question, but I see lots of hand sanitizing stations across malls and also at UVic. I would love to complement that with wash basins at the same time. So a quick answer is both are effective, but to me personally, nothing like a proper safe hand wash.
Great. Thanks very much, Rishi. I'm going to switch back now, Karen, and pivot back to you. We have a question from Pam, and she's wondering, are you still actively recruiting participants for your study from rural and remote communities? And there's a little bit more to the question. I think you probably can see that question as well in the Q&A, so maybe I'd invite you to answer that if you could.
Okay, and thank you. And I think Jennifer also had, I think her question had to do with recruitment
Right.
as well. I think that this was an excellent opportunity for me to actually recruit. So thank you to those who are asking questions around recruitment. I would love to connect with you. We are actively recruiting. We are also actively recruiting for our larger project, the Michael Smith Implementation Science Project, where if you saw the slide with the 4 different technologies, we are going to be doing an assessment and evaluation of those other technologies as well. But rural and particularly older adults living in rural and remote areas, their population that we really want to gain access to. So we would love to connect. I'm hoping that through the organizers, through the Alumni Association, I will be able to get information to you, and then we can connect at some point. Was there sorry, I didn't see the other part of the question, Lisa.
No, I think you've answered it. And so we'll make sure we provide that information for people who are interested. Karen, thanks.
Thank you very much.
Yeah, you know, just looking across the questions, now I'll come back to you now and ask a question from Matthew, and he's asking, and it just disappeared actually from the question.
I saw the question, Lisa. He's asking about the 30%.
Yes, and it just disappeared, but if you saw it, maybe you can answer it.
Yeah, I don't know where it went either, but
the programs that stopped at the beginning of COVID and why they may have stopped. Oh, there it is.
Yeah.
He says for the 30% of language programs that stopped outright at the onset of COVID, do you have any indication of why? Was it technology access or expertise or other issues?
Yeah, thanks, Matthew, for your question. So I do know a little bit about that. And also I would say, to be fair, that the study that we're doing is a preliminary study, and that we hope to be able to continue the research. And so that kind of thing is what we would probe further into. What we do know, though, is that technology is such a broad word. You know, we all use it all the time, but what does it really mean? You know, it means a lot of different things. But the one thing that I would say is for certain is that broadband is an issue, that, you know, there's a lot of inequities in Canada, and internet access is one of them. There's a lot of First Nations communities that don't have the same internet access. So it's not even necessarily about tablets and computers and so on. That's the kind of thing that you can get grants for and people can purchase. But strong internet infrastructure in your community takes much longer and takes a larger partnership of it's a larger enterprise. And I think that inequity in Canada has come to light during COVID. The other is that I do know of some programs that have been canceled, including some of our programs here at UVic, that have a really strong immersion component where people are working particularly one-on-one with usually an elderly person, and folks have had those hard conversations and just have said they just can't see how they could do the program to any degree of quality or satisfaction for the people involved, and have just said we're just going to take a pass this year and hope for the best next year.
Mm-hmm.
Hi.
Okay, thank you. I'm just going to go back to you, Rishi, and there's a couple questions there, but I'm going to ask the second one first. And maybe it's because I had this question on my mind. I actually wrote it down on my notes during your presentation, a very similar question. But one of our attendees is asking, is it too early to comment on your anticipated period of effectiveness of your antiviral coatings, or how often they need to be reapplied to surfaces? And I'll just add a little bit of what I was thinking. You know, when you showed the slide and you showed the doorknob and potentially the spray bottle, you know, where you might be able to spray it on, I immediately thought, oh my God, that would be great in the Michael Williams building. Where I sometimes get nervous about all of the people who've come back to work and are touching door handles, and I wondered how long such a spray might last. So do you have any idea?
So that's a great question. Definitely what I would expect from smart alumnus of UVic. The question is great from a few different aspects. So one of the aspects is how long is the coating simply going to last? The idea behind the coating is it's actually going to be very similar to a paint. So our industry partner actually uses equipment which is very similar to what's used on painting BMWs actually. So if you think about the door knob or the handle on your car, the paint can last a pretty long time, right? I mean, you know, it could be 15, 20 years before the paint goes away. However, the question is about the effectiveness of the antiviral properties, and that's a very good question. There are two aspects like I presented in my presentation. The super hydrophobicity of the coating will probably stay for a pretty long time, for years. But the chemical effectiveness, so if you have copper oxide, for example, or titanium oxide, which we are considering at the moment, some of these nanofillers or microfillers may lose their effectiveness over a period of time. So it's a great question. The physical aspect, I would say, would probably last for years. The chemical aspects, we are still looking into it. But I would say, again, I know the other question is also related to copper, for example. So the example is right here. Maybe Lisa, I can answer the other one also.
Yeah, I was going to ask you that one next. So why don't you go ahead? Because that's a very interesting question too.
Absolutely. So my copper mug is not because of COVID. This is something my my grandparents and parents always used to chat about, say, copper is really good, not just for, cups for drinking, but this is great. Even they would have plates and spoons actually made out of copper. So the answer here is, I've been using this for a pretty long time, still seem to be surviving. The idea here is the concentration of the copper that comes out of this. So if I leave water in the mug for a month, and then I sip off it, it's probably going to have a very strong concentration of copper in it. But if you leave it for a short period of time, then it's I'm assuming it's okay. And then again, I don't typically use it for cooking, because when you heat it up, then again you would imagine that there's more copper content in your solution. So at the moment, the mantra seems to be copper is very effective. Like I said, just a very rough comparison, if the novel coronavirus stays effective on, let's say, plastic for 2 days in certain conditions, on copper it might be 5 hours. So this is just a relative comparison.
Good, some practical advice there, Rishi, thank you. We have one question left in our Q&A box, and I think we'll ask it even though we're getting close to the end of our time. So now it's back over to you. And the question is, now that UNDRIP is part of the BC scenario since last year, how do you think that language revitalization impacts the BC human rights for children and youth? And what do you believe are the implications for BC representative for children and youth in the province and ministers working with children, youth, and families? Do you have any sense of that?
That's a great question. I have absolutely no idea what the responsibilities of all those people are, but I can speak to you about, so UNDRIP, for anybody who's on the session today that doesn't know about that acronym, it's the United Nations for the Declaration for the Rights of Indigenous People. And in the fall of 2019 in the province of British Columbia, we passed that into legislation and made a commitment as a province to implement that. So the one thing that I would say in regards to children and youth, which I think is what the person is asking about, is that Articles 13 and 14 speak specifically about language revitalization. And one of the things that's very interesting to me about both Canada and British Columbia taking up UNDRIP and actually passing it into legislation is that Article 13 says First Nations people, Indigenous people have the right to educate their children in their language. And what that means is that we have now a state legislated responsibility to support full immersion programs, essentially from preschool through to post-secondary. That's essentially what it means. And so now as citizens, all of us at universities and otherwise, and all of you on the call, now we have the responsibility to hold our government responsible for that huge commitment and responsibility. So as a person who's in the Faculty of Education and who's an educator, I'm certainly one of the people who will be holding the government responsible to that big commitment they made last year. So thanks for the question.
Thanks, Onowa. And I'm getting indications here that our time is short, so I think we'll have to move on from the questions. Thank you to all of you who provided questions for our panelists, and thank you for the answers all of you offered. I think this has been a really great event, and I just want to thank everybody for joining us today. It's been a really rich discussion. I appreciate the enthusiasm of our presenters, as I've said, and really thank you for giving your time tonight to share your work with us and with our audience. As many of you may have heard, the University of Victoria has established and provided seed funding for a research accelerator fund, which is designed to empower our world-class researchers to respond to the urgent needs of communities by rapidly advancing COVID-19 resilience and recovery efforts. Through this Research Accelerator Fund, donors are provided with a unique opportunity to affect meaningful change by investing in community-driven research that reduces the negative impacts of COVID, both locally and beyond. And you heard about some of that research here today. On the closing slide this evening, there will be a website address if you would like further information about this fund and how you can make a difference. Tomorrow, you'll receive a short survey, and we would very much appreciate hearing your feedback on this event. This will help the alumni team to organize future events. On behalf of the UVic Alumni Association, thank you for attending this evening. It's been great, and I hope that you have a wonderful rest of your evening. Good night, everyone.